Welcome to this explainer. Today we're going to break down the science, the steps, and the recovery of a super common but honestly often misunderstood procedure, the cesarean section. Whether you're an expecting parent, a curious student, or really just someone who loves understanding how absolutely incredible modern medicine can be, you are totally in the right place. We're going to unpack exactly what happens before, during, and after a C-section.
All right, let's look at our game plan for today. We'll hit what is a C-section, 2, why are C-sections performed, 3, prep and anesthesia options, 4, step-by-step surgery, and finally, 5, recovery and healing process.
Section 1. What is a C-section? Understanding the basics. Let's jump right into it.
So, at its very core, a C-section is really all about one single thing: safety. It's a surgical procedure to deliver a baby via the abdomen, serving as a super vital alternative to vaginal delivery when it's absolutely necessary. A physician makes the call to go this route when they determine it's just hands down the safest delivery option for the mom, the baby, or, as is often the case, both of them. At the end of the day, it's all about ensuring the healthiest possible outcome.
Section 2. Why are C-sections performed? The indications.
It's kind of a common misconception that every C-section is some frantic, last-minute emergency. But actually, scratch that, a huge number of them are very carefully scheduled. Mothers can choose to have a planned C-section, which is known as elective surgery. This is generally booked right around that 39-week mark of pregnancy. Plus, for women who have already had a previous C-section, doctors will very often advise them to deliver their next babies the exact same way, just to keep any potential risks as low as possible.
There are quite a few physical or spatial complications that make an abdominal delivery the absolute safest bet. Take labor dystocia, for example. That basically just means the baby's head is a bit too big to safely fit through the mom's pelvis. Then there's placenta previa, which is pretty serious. It's when the placenta partially or wholly covers the opening of the uterus, totally blocking the exit. You've probably heard of a breech position, right? That's when the baby's feet are pointing down instead of the head. And macrosomia, that's the medical term for when a baby weighs more than 4 kilograms. That's a big baby. Oh, and of course, if a mom is carrying multiples, like twins or triplets, a C-section is usually the way to go.
But listen, we definitely also need to talk about the true emergency indications. Sometimes things just escalate unexpectedly during labor. A prolapse of the umbilical cord or sudden fetal distress, those are massive, immediate emergencies. They can cause a really rapid loss of oxygen to the baby, which could tragically lead to a stillbirth if the team doesn't move fast. In those terrifying moments, a C-section is a literal lifesaver. Other crucial reasons might include things like a pelvic tumor, cervical cancer, or an active herpes infection, which you absolutely do not want to pass to the baby during a vaginal birth.
Section 3. Prep and anesthesia options. Getting ready.
Okay, so let's virtually step into the operating room. The prep here is incredibly organized. First up, the medical team places an angiocatheter right into the patient's hand to deliver fluids and medications. Next, they insert a bladder catheter to keep the bladder completely empty and safely out of the way. And here's a detail I love. They deliberately put up a visual barrier sheet between the operation area and the mom's head. That way, she doesn't have to actually see the surgery happening, which is super comforting when you're in such an intense clinical environment. Now, when we look at anesthesia, we've basically got two main paths. General anesthesia completely knocks the patient out. She's not conscious at all. The big downside? The baby absorbs some of those meds, which can lead to the newborn being sedated at birth. Because of that, general anesthesia is really reserved for absolute emergencies where speed is literally the only thing that matters. On the flip side, regional anesthesia, like a spinal block, is the standard method of choice. The spinal nerves are numbed, so the mom feels absolutely zero pain, but she gets to stay wide awake to experience the birth. And the best part, the baby gets none of that numbing medication. Section 4, step-by-step surgery, the procedure. So what exactly goes on behind that drape? It's basically a highly choreographed progression through the body's protective layers. Step 1, the doctor makes a skin incision. Sometimes it's vertical, but usually it's a horizontal cut right above the pelvic bone, what people call the bikini line. Once through the skin, the surgeon meticulously cuts through the fascia, fat, muscle, and peritoneal layers. Then they very, very carefully push the urinary bladder to the side to protect it. Finally, they make an incision directly into the uterus, rupture the amniotic sac, and boom, the path to the baby is clear. And here it is, the absolute climax of the whole shebang. The baby is gently guided out of the uterus. The umbilical cord is clamped and cut, and the newborn is immediately bundled up in warm towels and handed straight to the pediatric team for their very first medical checkup. It is just such an incredible, magical moment of transition.
Of course, the baby is out, but we aren't quite done yet. The medical team has to carefully wrap things up for the mom. They gently remove the placenta from the uterus. Then, working backwards layer by layer, the surgeon meticulously sews everything back together, making sure the body is perfectly positioned to heal safely.
Now get this, you might be totally shocked to learn that the duration of this entire major abdominal surgery, from the very first cut to the absolute final stitch, is usually just 15 to 30 minutes. No way, right? It's remarkably fast, which is on purpose. It significantly minimizes the physical stress on both the mom and the baby.
Section 5. Recovery and healing process. The aftermath.
So a lightning-fast surgery doesn't exactly equal a lightning-fast recovery. Following the birth, mom isn't just grabbing her bags and heading straight home. She'll generally stay right there in the hospital for 4 to 7 days. This gives the nurses and doctors time to closely monitor her vital signs, get her pain management dialed in, and make sure those crucial early stages of healing are going smoothly.
Here's a detail I find just absolutely fascinating. One of the best post-surgery medical prescriptions? Just walking. Getting out of bed and walking around is a total game changer. It speeds up overall recovery, it helps ease those brutal gas pains, it wakes the digestive system back up so you can have a bowel movement, and, this is the big one, it prevents the formation of dangerous blood clots that can pop up after surgery and bed rest.
But honestly, the human body is just ridiculously resilient. Look at this timeline. The surface healing happens incredibly fast, with the skin incision usually sealing up in just 8 to 12 days. Over time, that raised red line will mature and get much thinner and flatter. And looking long-term, the scar usually just fades out, turning white or blending right into the natural color of the skin.
So, I'm going to leave you with this thought. We've just seen how a flawlessly efficient 15 to 30-minute surgery absolutely demands days in the hospital and literally weeks of intense physical healing. Understanding the gravity, the medical necessity, and the raw physical toll of a C-section is fantastic, but it's only step one. The real question for all of us is, how can we use this knowledge to better prepare and actively support these new mothers once they walk through their own front doors to start that postpartum journey? Definitely something to think about.